Hi guys, this is Dr. Brian Opp from Opp Family Chiropractic right here in St. Francis. And today in this video, I want to talk to you about a tiny little organ on your right side called your gallbladder. So stay tuned and I'm going to talk to you why it's super important and why you need it. Do you know that over 300,000 gallbladders get taken out on a yearly basis? Did you know that over 300,000 gallbladder surgeries are performed to remove it on a yearly basis? You got to start wondering why. And why do they think that it's a disposable organ, that we just don't need it? If we take it out, we're just fine. Well, and what really causes some of those issues in the first place? Well, did you know that the gallbladder is one of the most, if not the most, estrogen sensitive organs in our body? So that means if you have an excess of estrogen, your gallbladder is going to suffer for it. That's why you see a majority of those 300,000 being females, right? A little more estrogen in their bodies than a male does. So they have more issues when it comes to that aspect. So if you don't have it, okay. So what is the gallbladder good for in the first place? Well, it's needed for digestion, right? So bile breaks down fats. So if you don't break down fat, guess what happens? That fat eventually gets down into your colon and the bacteria down there starts to eat it and produce what we call oxalates. Oxalates are bad news, right? Often they'll give us kidney stones, but they'll also be able to get into a joint and then we get joint pain. They get into muscle, we get muscle pain. It's also linked to a decrease in sulfur in our body. We need sulfur for every process in our body. If we don't have it, we usually end up with some kind of chronic illness, and it's not the good kind, okay? Next, it helps us with our hormones and balancing our hormones. Why? Like I said, the gallbladder is estrogen sensitive. So if you have excess estrogen, that bile is needed to do the final step of breaking down that estrogen. That's why if you have too much, it's too much for the gallbladder, it can't handle it. Then you start to get a sluggish gallbladder, you get stones, it gets backed up, it just can't handle the load. So we need to be able to treat that gallbladder good if we want to balance our hormones. Lastly, it is actually an immune system organ as well too. If you think about it, bile acts like soap. So when it cleans up the intestinal tract as it's breaking down those fats, it can help prevent some of those infections that often occur in us. SIBO being one of the big ones. You often see when somebody gets a gallbladder removed, they actually start having digestive issues shortly thereafter. That's the reason. It's because they now allow those infections to grow. So how do we support and love that gallbladder like we should? Well, the gallbladder usually is dependent on the amount of hydrochloric acid or stomach acid you have. If you have low stomach acid or weak stomach acid, the gallbladder is just going to sit there. It's not going to squeeze. So we get what's called a sluggish gallbladder. And the inside there, the bile actually turns like sludge. So then we can't get that out of there and we end up with a stone, it gets stuck, and you know the rest of what happens. You become a 300,000 annually taken out gallbladder. Next, often we have our patients use some bile acids to help with supporting that gallbladder. If we can help give it a little bit of a break, it can help heal that up and get rid of some of that estrogen in the meantime as well too. Some other things that are really good are taurine and B6. Really good at helping improve the slipperiness of the gallbladder, and choline. It's all needed to make that gallbladder work properly, squish the way it should, and have that slippery bile the way it should so it doesn't get stuck in that gallbladder. So if you know somebody who's dealt with gallbladder issues or currently thinks maybe they have, one of the telltale signs is you eat a meal or a fatty meal and you get bloating an hour, 2 hours after, or you're burping up your meal an hour, 2 hours after, that's more than likely your gallbladder because it's past your stomach, it's now been worked on by your gallbladder and you're getting burping from your small intestine. So if you have some of those issues or something else that might be going on digestively, it's often due to that stuff at the top. Give our office a call. We can definitely help you get on the right track. This is Dr. Brian Opp from Opp Family Chiropractic. Hope you enjoyed this video.